Minister, this motion from Sinn Féin highlights many of the critical issues facing our health service. Your motion, on the other hand, outlines much of the work undertaken by government, and indeed there is some progress. However, it's from a very low base in that the number of inpatient acute beds per capita in Ireland was one of the lowest in Europe. And just to start redressing that situation, we needed to employ significant numbers of staff to support those beds. I note that you quote the number of nurses per head of population as being positive in this country, and it is. But I also notice you didn't quote the number of specialists, the number of consultants, the number of physiotherapists, the number of occupational therapists, and many other healthcare staff per head of population. That is because we are well below the per capita rate of very many developed countries. Minister, the bottom line for most people is, if they need treatment, they'll ask, will my treatment be available in a timely manner? Will my surgery proceed within a reasonable length of time? Why are waiting lists so long? Why do I have to wait on a trolley for days on end before I can get a bed? Those are the realities that people face as they themselves or their loved ones seek urgent and necessary care. When I speak to people who need to attend Sligo University Hospital, they quite rightly say to me that they are concerned about going to A&E because just today, Minister, our local radio station, Ocean FM, reported there were 61 people waiting for a bed in the emergency department, the second busiest most overcrowded hospital in the country. And Sligo University Hospital is a small hospital compared to many others. So those numbers, pro rata, are worse than what we see elsewhere. If you check the figures on Trolley Watch, I just looked at the first 6 months of this year for Sligo University Hospital. 3,926 people during that 6 months were waiting for a bed. Now, Minister, the government motion tells us of money spent and staff employed, but I have to say to you that the people in the North West have yet to see any real positive impact of government policy. And then on top of this, we have the bombshell of the embargo on most frontline posts. This was announced because the HSE had already spent its budget. Talk about a crude instrument of rebalancing. Just cut off new recruitment of most healthcare workers. Close the door, pull down the shutters. No analysis of areas in dire need. No analysis of different healthcare settings and what is required to deliver a decent, viable service. We have the situation that healthcare staff who have been interviewed, who are awaiting their contract now, this minute, and they might be going through a Garda vetting process, they might be going through CORU registration or perhaps occupational health screening. And what happens? Jobs withdrawn, rug pulled under them, just like that. I just wonder, has anybody looked at the potential impact of this crude policy instrument? It's no wonder that the INMO Secretary, Philny Hay, has said this recruitment freeze represents a serious error on the part of the employer and the impact on the provision of care is going to be disastrous. Already, Children's Health Ireland are warning us about overcrowding in Temple Street, Crumlin and Tala. Minister, you know something, I do understand you don't have a bottomless pit of money. But if there is a problem, you identify the problem, you look to see what are the causes of that problem. How did we get to this point? You don't throw out the baby with the bathwater. You don't throw the toys out of the pram. You find a solution, find a way that best protects our patients, our healthcare staff and our healthcare system, not a sledgehammer to crack a nut recruitment freeze that I believe and many others believe can do untold damage.